Tell me a little bit. What is PVD?
Peripheral vascular disease or peripheral arterial disease, PAD. It's known by a few different terms, but basically it's where you have narrowing in the arteries, usually in the lower extremities, and also usually caused by atherosclerosis. And that narrowing is enough to impede blood flow to the feet and sometimes cause symptoms. A lot of people that have peripheral arterial disease are asymptomatic. The most common symptom is intermittent claudication, and what that is with activity you get cramping in your legs, and after a period of time the cramping starts and gets worse, and then with a period of rest the cramping goes away, and it should be reproducible, whereas every time you have that exercise you get the symptoms, and every time you rest the pain goes away. Symptoms in severe PAD can be even pain at rest, or in really progressive cases you can have tissue loss or even ulceration or gangrene. So really there's a spectrum based on the severity. The treatment for PAD in a lot of cases is just lifestyle modification. The most important thing is to stop smoking if you're a smoker. That's the #1 thing you can do to treat PAD. Other than that, you can, exercise is always beneficial, a supervised walking program, as well as a low-fat, low-cholesterol diet. Sometimes if lifestyle modification is not sufficient to treat the PAD, medical therapy would be needed, and that might include prescriptions written by your doctor to control high blood pressure, control cholesterol, antiplatelet or anti-clotting medications and such as that. Heart attack and stroke are caused by similar narrowing of the arteries. Atherosclerosis can cause, it basically is cholesterol and fibrofatty plaques forming in your arteries, and those can narrow the arteries. It's a similar process that is seen in PAD. That can impede blood flow to your brain and to your heart. So there's a close association between PAD and heart disease and cerebrovascular disease, since all three are usually caused by atherosclerosis. Fortunately, the screening for PAD is very simple. It's a blood pressure that's taken in your arm and in your foot, and the two values are compared. It can be performed in generally any doctor's office. If you have leg symptoms, I wouldn't ignore that and chalk it up to just normal aging. You need to call your doctor and make an appointment to have your legs evaluated. Generally, it's recommended that all patients over 70 be screened for peripheral arterial disease. Also, patients over age 50 who have a history of diabetes or smoking. In some cases, medical therapy is not sufficient to treat the narrowing and to reduce the symptoms. In such cases, surgery, such as bypass, may be needed, but more and more today we're able to treat the narrowings with minimally